You may be asking yourself, is training to failure the best way to train? In some instances, it can lead to great results. Others, not so much. So, let's talk about what training to failure means, the pros and the cons of it, and how to apply it to your own training routine. First, let's frame what we mean when we're saying training to failure. It's the process of repeating reps of an exercise to momentary muscular failure, or the point where the neuromuscular system can no longer produce enough force to control or overcome a specific workload. To achieve muscle failure, methods like performing drop sets, which is lowering the weight when you can no longer perform a concentric contraction, partner-assisted reps, eccentric only reps, which is only performing the lowering portion of the lift, commonly referred to as negative reps, and isometric holds are typically the methods that are used. For the sake of our discussion going forward, when referring to muscle failure, we will be talking about the concentric phase failure that occurs with the specific workload initially lifted. At this point, the set would end and a rest period would follow to allow for the resynthesis of ATP and the clearance of fatigue-producing substances like hydrogen ions.
What is the purpose of training to failure? Performing sets to failure with heavy resistance may activate a greater number of motor units. During a typical heavy resistance exercise set, the pattern of motor unit recruitment follows the size principle, which means recruiting muscle fibers from smallest to largest. A recruitment threshold exists whereby lower threshold motor units, composed of predominantly type 1 slow twitch or type 2A fast twitch muscle fibers, are recruited first. As consecutive repetitions are performed, these motor units become progressively fatigued, at which point additional higher threshold motor units composed of predominantly type 2X fast twitch muscle fibers are recruited. The recruitment of additional motor units as a result of fatigue may provide added stimulus for hypertrophy and strength gains. The reason we say may provide added stimulus for hypertrophy and strength gains is because there is a challenge when it comes to comparing the efficacy of failure versus non-failure approaches when equating training volume. If training volume is defined as the load lifted per set multiplied by the sets performed per exercise, multiplied by the repetitions completed per set, or load times sets times repetitions, then performing 3 sets to failure could result in a higher volume versus performing 3 sets with submaximal repetitions if the load and the number of sets are equal. The strength increases might be greater with the training to failure approach simply because of the higher training volume, rather than reaching failure. When determining if training to muscular failure is beneficial or necessary in your program, you have to look at what the purpose of your current training protocol is, or what your fitness goals are.
If the goal of your current training protocol is to develop maximum power output, such as seasonal athletes, training to failure is likely not the optimal choice, as performing sets to failure may hinder the development of muscular power because of reduced acute power output and movement velocity. Izquierdo and colleagues determined that maintenance of high repetition velocity is best accomplished by ending a set well ahead of reaching muscle failure. In one study, bench press and back squat repetition velocity were examined throughout full repetition max sets performed at 60, 65, 70, and 75% of 1 rep max. The results demonstrated that the rate of decline in repetition velocity was not significantly different between all percentages of 1 rep max examined. However, significant reductions in repetition velocity occurred at 34% of the total reps for the bench press and 48% of the total reps for the back squat, irrespective of intensity. If the purpose of training is to maintain a high movement velocity, upper body movement sets should be ended about 1/3 of the way to the repetition max, and lower body movement sets should be ended about halfway. In another study, Izquierdo and colleagues examined repetition failure versus non-failure training approaches on muscular power using the ballistic bench press and back squat with 60% of 1 rep max. Muscular testing and blood draws were conducted to determine basal hormonal concentrations before the initiation of training and at regular intervals throughout the study period. After an initial 11-week training cycle, an additional 5-week peaking period was included during which both groups performed the same ballistic style, non-failure training program designed to maximize power. The initial 11 weeks, increases in power were higher in the non-rep failure group for the bench press and back squat. During the final 5-week peaking period, the non-rep failure group continued to increase muscular power, despite both groups performing the same ballistic style non-failure training program. A key finding was the repetition failure group experienced a reduction in resting insulin-like growth factor 1 concentration, whereas the non-rep failure group experienced a reduction in resting cortisol concentration and an elevation in resting serum total testosterone concentration. This may indicate that the failure group was in an overtrained state, as evidenced by the reduction in resting insulin-like growth factor 1 concentration. The results of the study suggest that consistently performing sets to failure may actually inhibit gains in power, despite absolute strength results being equivocal and localized muscular endurance results being greater by reaching failure, which we'll talk about.
Training to failure might be most beneficial when programs are structured for increases in strength and hypertrophy. Because muscular hypertrophy is a major contributor to long-term increases in maximal strength, advanced lifters might consider training to failure occasionally. After the initial 11 weeks of ISHII's study, absolute strength of the bench press and back squat was also examined. The repetition failure and non-repetition failure groups demonstrated similar percentage increases in 1 rep max bench press and 1 rep max back squat. Be that as it may, other research has demonstrated that during 6-week cycles, training to failure resulted in superior increases in strength and hypertrophy in both untrained subjects and elite athletes. These adaptations were attributed to greater activation of motor units and secretion of growth-promoting hormones. However, as mentioned earlier, training to failure should not be practiced repeatedly over long periods due to the potential for decreases in growth-promoting hormones, as shown by the previously mentioned study lasting 11 weeks, and increases in overuse injuries. A study by Drinkwater and colleagues examined the efficacy of training leading to repetition failure on 6-rep max bench press strength and 40-kilogram bench throw power output in elite junior athletes. After the pretests, participants were matched based on their initial strength level and assigned to one of 2 bench press training groups that performed either 4 sets of 6 reps to failure or 8 sets of 3 reps not to failure. Both groups were equated for volume, performing 24 total reps each workout at a relative intensity of 85 or 105% of their 6-rep max, training 3 times per week for 6 weeks. To ensure muscular failure was reached during each workout, the repetition failure group needed assistance on at least 1 rep, whereas the non-failure group was able to complete all reps without any assistance. Greater increases in 6-rep max strength were demonstrated by the repetition failure group versus the non-failure group. Additionally, greater increases in bench throw power were demonstrated by the rep failure group versus the non-failure group. However, a second experiment established that the repetition failure protocol induced greater fatigue, as indicated by less power when the bench row was performed immediately before and after lifting. That's important to note because the greater fatigue following sessions that involve sets to failure may interfere with other important components of conditioning like sport-specific skill practice and related movement training. The difference between the results for these other studies and those reported in ISHII's studies might be accounted for by the length of the study periods. For example, 2 of the studies that demonstrated the superiority of training to failure were conducted only for 6 weeks. This may indicate that training to failure can be advantageous, but only when prescribed sparingly and not for more than 6 weeks at a time. Incorporated periodically into short-term microcycles, training to failure might in fact provide the extra stimulus needed for advanced lifters to break through plateaus. On a hormonal level, in the 2004 study, Muscular Adaptations to Combinations of High and Low Intensity Resistance Exercises by GOTO and colleagues, it was found that after a strength-based set, meaning 90% or more of the 1 rep max lifted, immediately dropping down to an exhaustive set at 50% of the 1 rep max caused marked increases in lactate and growth hormone concentrations in the blood. This would mean more energy can be produced with an expectation of increased muscle mass.
Because of the definition of localized muscular endurance, which is the ability to sustain repeated submaximal muscle actions, the assumption might be that repetition failure sets would be an ideal training approach for increasing muscular endurance. The aforementioned study by Izquierdo and colleagues demonstrated that a repetition failure approach resulted in greater gains in localized muscular endurance after 11 weeks, where localized muscular endurance was higher in the repetition failure group for the bench press, but not significantly greater with the back squat. Willardson and colleagues demonstrated similar results in comparing failure versus non-failure training approaches with equated intensity and volume on lower body muscular endurance in trained men. Each participant performed one lower body workout per week for 6 weeks that involved the squat, leg curl, and leg extensions. Participants in the failure group performed 3 sets of 13 to 15 repetitions till failure, whereas the participants in the non-failure group performed 4 sets of 10 to 12 reps and did not reach failure on any set. The additional set performed for each exercise by the non-failure group allowed for the volume to be equated between groups. Both groups performed pre- and post-intervention muscular endurance tests, during which concentric work was assessed over 3 sets of the back squat, leg curl, and leg extensions. Concentric work was assessed using the 15 rep max load for each exercise, multiplied by the distance of the total load, including the body mass, was lifted per rep, multiplied by the maximal repetitions over 3 sets for each exercise. Both groups demonstrated significant increases in total work during the post-intervention test, with no significant differences between the groups. These results suggest that when intensity and volume are equated, failure or non-failure training approaches will result in similar gains in lower body muscular endurance. As mentioned moments ago, in the Izquierdo and colleagues study, despite significant greater gains in bench press reps with the failure approach, back squat repetitions were similar with both the failure and non-failure approaches. Therefore, it appears that a repetition failure approach might be a better method for upper body endurance. Conversely, when training for lower body endurance, the total volume, load times sets times repetitions, might be more important versus whether or not sets are performed until failure.
Now let's discuss some of the limitations of training to failure, and conversely, how to use this method as an effective training modality. A drawback of training to failure is the amount of time needed to complete a workout. In studies conducted by Jeffrey Willardson and Lee Burkett, it was found that when multiple sets of the bench press and back squat were performed to failure, the amount of reps performed were significantly reduced over consecutive sets with an absolute load. This was true even when using 3 to 5 minute rest intervals between sets. To counter this, it was suggested that the weight be progressively reduced. This held true for experienced lifters and novice lifters alike. Progressively reducing the load reduces the absolute training intensity, which is not ideal when training for maximal strength. Therefore, in order to perform multiple sets to failure without reducing the absolute training intensity, long rest periods are required to maintain total volume. Failure training performed too frequently may promote psychological burnout and the overtraining syndrome, which for athletes could be especially detrimental to performance during late preseason and in-season cycles. It may also result in decreased resting levels of testosterone and increased resting levels of cortisol, which are counterproductive to hypertrophy. Therefore, training to failure can and should be periodized, just like other well-established prescriptive variables like intensity, the number of sets, and rep ranges. Trained lifters may tolerate sets to failure with greater frequency versus untrained lifters. The current research suggests that performing sets to failure may provide greater gains in absolute strength, hypertrophy, and localized upper body muscular endurance when practiced consistently over 6-week cycles, interspersed with exclusive non-failure cycles over equal periods. When power production is the objective, training to failure should be discouraged, and coaches should consider athletes' training status and goals and the point in a yearly training cycle to determine whether sets are to be performed to failure or ended short.
An effective strategy might be to alternate microcycles in which failure is reached on most sets, with microcycles in which sets are performed according to repetition zones, or RM percentages that do not require failure. For older adults and individuals who lift recreationally for the purpose of improving physical function, there is no reason to train to failure. Therefore, the training status and goals of the lifter should guide the decision-making process on this issue. Another strategy for trained lifters, reaching failure might be prescribed only on the last set of a given exercise or series of exercises that address similar muscle groups or movement patterns. This strategy is nothing new in that reaching failure only on the last set has been practiced for decades. However, by limiting the number of sets to failure, the risk of overtraining is reduced, and coaches might be able to effectively address other training objectives during the same workout. For example, begin a workout by alternating high-intensity, non-failure sets with plyometric drills for power development, and then end a workout with limited full rep max sets for absolute strength or hypertrophy development. To conclude, training to failure is best used sparingly, with the best results being for hypertrophy, max strength, and upper body endurance. Knowing this, it is always important to keep an eye on overtraining. However, even when not training to failure, it is important to push yourself close to those limits to maximize results. We hope you enjoyed that dive into training to failure. Please like, subscribe, and comment for more content like this, and until next time, make sure you're working out just as smart as you are.